All right, well, welcome to Arizona Facial Plastics. Today we're going to be doing a Vivace treatment on the scalp. And we're going to be making microchannels with the Vivace. And then we're going to be channeling in amnion from Amnio Aesthetics. And then we're going to be doing some aftercare training for the patient with some of the hair products from Omni. So I will get started. This is the Vivace system. Essentially, when we look at the Vivace, it's a micromotor-driven microchanneling. These are guarded needles. We're going to be turning down the energy. We want just a little bit of energy to coagulate the channels. Channels will be open about 4 to 6 hours, so that'll be good to get the amnion in. We're going to be upsetting it to 2 megahertz so that we limit the amount of energy from the distance off of the needles. These are gold tip needles, they're guarded. And for the scalp, we usually go between 22 and 2,500 microns. Our patient here is a 55-year-old wonderful gentleman who's joining us today. He has early male pattern baldness, so we're going to be working mostly on the vertex, and we'll have some pictures to post here as well, hopefully, on the crown. And we're also going to be doing some treatments on the anterior scalp in the vertex regions where he has some recession of his hairline. So we're going to be treating from here all the way back to here with the Vivace, and then we're going to go straight to the amnion, and then we'll do some after training. Throughout this Facebook Live event today, we're more than happy to answer questions. So if you guys have any questions, please text them to us.
Actually, we can answer live,
and we
also
can answer them live. So as we're, Antoinette will just scream out the questions to me, and we will try to address them for you. So thanks so much for coming today. Thank you, my friend. I appreciate your cooperation. First thing we're going to do is we're going to place the position of the patient in a way that we can easily access. Now, usually I will lay the patient flat, but in this case, for the purposes of the filming, we're going to keep him at this angle. Stacey, can you stand over here for a second? Mm-hmm. Just hold this handpiece for me. There you go. You can rest your head back. There you go. Now, the scalp has been numbed with Pinnacle Pharmacy numbing cream. Pinnacle is a numbing cream that we get through Aesthetics Biomedical and Pinnacle Compounding. It is individually scripted for the patients. This is 20% benzocaine, 8% lidocaine, 4% tetracaine. What makes this numbing cream special is the VersaPro base. So for scalp numbing, this is really, really good. So we have numbed his scalp for approximately 40 minutes. We've just cleaned the scalp, so we just pulled the numbing cream off the scalp. And now we're going to get started here. So we're going to start with the Vivace. So you can just relax here. We're going to start with the anterior hairline. So we want the ideal hairline to come out to about this area. So this is the area where he has lost hair. And we're going to start with the channels. Again, these are short pulsed intervals. We're using guarded needles, again, to limit the amount of thermal spread in the hairline. And off we go.
Julie from Colorado says hi. Hi, Julie. Thanks for watching.
How you doing, my friend? Good? Good. Is it pretty comfortable? Mm-hmm. Yeah. So he's tolerating it well. On his... Is a question?
No.
So I'll just talk through this a little bit. So the Vivace is a really third generation microchanneling with radio frequency device. It's really the first device that you would ever dare put on a scalp. Competing products use solenoid and hydraulic motors, which are snap motors, which would lead to a lot of tissue damage and bleeding, which you would never do on someone's scalp. The Vivace is the first system to use robotic micromotors to gently drive these needles in. And essentially what we're doing is we're using the Vivace
Pull his hair back a little so we can see the needles being driven.
Okay, so we're just driving it right into the scalp.
Nice.
Again, this is my own treatment at Arizona Facial Plastics. So I am a facial plastic surgeon. These are my own treatments that I've created with the Vivace. But the machine is made by Aesthetics Biomedical in partnership with our manufacturers. So what you can begin to see is you can begin to see the channels, and you see just very, very minimal pinpoint bleeding here, but you're not getting gushing of the blood because of the guarding of the needles, the coagulative effect. Questions?
No.
Sir, on a scale of 1 to 10, how much is the pain?
Oh, maybe about a 3 or 4.
So 3 or 4. So very, very mild. And this is with the numbing, so it's very good. We try to pull the hair aside so we don't grab the hair with the channels going in, but you can begin to see the effect. Usually I'll do about 3 or 4 passes with the needles at this setting. We can actually go a little bit deeper. He has somewhat of a thicker scalp. We can sort of feel it as the needles are going in. So we will turn it up just a little bit, but we're at 2200 microns right now. We've set the machine level 2 and the 100 milliseconds. The Vivace is the first system where you can actually change the frequency of the energy. So we're using 2 megahertz to narrow the field with which the needles are traversing the skin. And we're just going to kind of go over the scalp about 3 to 4 times, and then we're going to apply the amnion. You doing okay, my friend?
Uh-huh.
That was the first pass.
First pass.
Okay. So now we're going to come back here and we're going to start all over. Okay. So we're going to do the second pass at about the same depth. We're barely overlapping, maybe 5 to 20%. You just have to keep an eye on the scalp. The needles will drive through. This treatment you can do with PRFM, you can do it with PRP. My favorite is amnion, and amnion has a lot of anti-inflammatory growth factor properties. This is a certified tissue bank product, and again, it is for topical use only on the aesthetic side. So we essentially will be putting it topically to coincide with the channels. The reason the Vivace we feel works better than traditional microneedling is microneedling will tend to tear the scalp. You get the tearing effect. And the tearing effect is bad because it basically creates a lot of bleeding and the channels get plugged up. These channels are actually good for about 4 to 6 hours. So if you had patients taking PRFM or PPP, pour plasma home, they can continue to massage it on their scalp for hours after the initial treatment. But our friend here is doing a great job. I'm just kind of going over this on the second pass here. And you can really see the scalp pinking up nicely. Okay, so we did the second pass at about 2200 microns. Now for the third pass, we're going to go just a little bit deeper, maybe to 2500 microns. Okay. And again, here with the Vivace, we don't want to twist, we don't want to push. The micromotors will sense the depth and they will go to the correct depth. Now we're at about 2500 microns. The nice thing about the Vivace is that there's no timing out of the counts. So a lot of the other microneedling with radiofrequency systems, so we're right now at 189 pulses. With other systems, we would basically be burned out with the tip. With the Vivace, this same needle could be used to treat his face, his décolleté, his arms, etc. That's why in our practice we have such a high ROI with the Vivace, because we have such a low consumable cost. These needles are very well manufactured. There's no timing out of them. And you can see if he had less hair, we could easily put 400 to 500 pulses on his scalp. And with some of the competing products, which again with the solenoid motors, we would never dare drive those into the scalp. You're watching? So we would never dare with some of the other machines to snap them onto the scalp. So let me just talk a little bit about the micromotors. We're coming into the end of our third pass. And how are you doing, my friend? You doing all right?
Doing good.
Okay, so he's having very little discomfort as we do this. You can see the scalp pinking up real nicely. We're just finishing up this second pass here. I'm just going to come on the anterior hairline here just a little bit. Let's talk a little bit as we go between our second and third passes. We'll give our friend here a little bit of a break. What makes the Vivace really unique is that this is micromotor driven. So there are three types of motors that are used in systems that compete with the Vivace. One is called solenoid. Solenoid is a snap motor. It's on and it's off. So the needles are not gently pushed in, they snap into the skin. When you have the snap effect, there's some question as to whether the radio frequency is delivered at the point at which the needles are inserted because it's going so quickly. But more importantly, you get a lot of tissue damage, you get bleeding, and certainly on something as delicate as hair rejuvenation, you would never want to use a solenoid motor on something like this. Hydraulic motors have the same problem. Hydraulic motors tend to be weak. So if you want to do 2,500 microns, some of those systems don't even go past 2,000 microns. So the micromotor gearing that's in the Vivace is very, very good because for the scalp treatment, we really want to try here at Arizona Facial Plastics to get those needles in deeply, and the micromotors allow us to do it. Also, we have the ability to change the frequency of the energy, so we can essentially go between 1 and 2 megahertz. We have guarded and unguarded gold-tipped needles, gold being critical because it's hypoallergenic, unlike some of our competitors that have used heavy metals or metal-type needles, which can increase the risk of hypersensitivity. But we essentially, through a comfortable treatment, we're able to do this. So at Arizona Facial Plastics, I love to do this. I love to do different types of growth factor products, PRFM, platelet-rich plasma. There's some serums, which I'll show you, that are very good. You could use with microneedling on the scalp. And then we have some after products as well. But really, amnion, I feel, is one of the gold standards for getting high concentrates of growth factors. And, this is products that licensed physicians, like any tissue bank product, you can purchase. And again, we're using it topically in this instance. Okay, so now we're going to stay at 2,500 microns, level 2, 100 milliseconds. Okay, 2 megahertz. Okay, and this shows you the depth into the scalp that we're going into. So it actually will vary based on the setting that we do. And we're going to go after our third pass, and then we'll finish up with a fourth pass and do the amnion here today. Any questions out there for our subscribers?
None yet. So how frequently should this treatment be done?
That's a great question. Usually, you can do a series of 2 to 3 treatments, and you can space them between 6 to 12 weeks apart. The key is to have the after products ready to go. That's really where it works well. Wonderful combination with minoxidil, so if people are on minoxidil, they can stay on it. If you're using a variety of growth factor hair products, which we'll talk about here in a few minutes, fantastic for that application. But basically this is it. And again, you can hear the micromotors, it's quiet, it's not snapping, he's not flying out of this chair. We use the Pinnacle numbing cream, part of the Vivace experience. Just fantastic, just all-around treatment. One question that's come up is, can you use this in female pattern hair loss? Absolutely. Women's hair loss pattern tends to be a little bit different than men. You get a lot of crown thinning. You can also get some thinning here in the vertices, and fantastic for female hair loss. And again, what's beautiful about this machine is I can take the same tip, do a face treatment, do a neck treatment. You can keep going. There's no timing out of the tip. Right now on our third pass, we're at 271 fires. Some of our competitors, we'd be done right now. We have to pull out another consumable. Aesthetics Biomedical has made this real nice for us because this consumable is the consumable cost to the practice is very, very reasonable, around $75 or so, and this obviously gets put into the price of the procedure, but it's not unreasonable. Some of our competitors and other systems that we evaluated here at Arizona Facial Plastics, really you're looking at $300-400 in consumable costs. And it's hard to sell somebody 3 treatments when at $400 of consumable cost per treatment, you're $1,200, and the poor patients have to bear that cost. The Vivace is not only, we feel, a technically better system, but it's actually more price-friendly for consumers. Okay, so there's our third pass, okay? So beautiful. So you can really see the hair, everything pinking up. Feels a little bit thinner. We could even come in close so you could see some of the channels, but you can see some of the, and you can see no heavy bleeding, so we have the nice coagulative effect. And now we're going to do just one more pass. We're going to go just a little bit more superficial, just for one final pass. And this one is really just for the anterior line here. So we're just going to kind of...
You had mentioned pricing to the practice. What would you, we have a question from Julie.
Yes.
And her question is, what is the typical price for the procedure to the client?
It really depends on which growth factor you're using. So amnion being the higher end, okay? So, if you want to text me privately, I can go through some of the pricing that we procure, we get the amnion from. But it really depends on what the consumable cost is of the growth factor product. This is really just creating channels in the skin. So we're basically, getting a base price for the treatment. And again, you can complement this with face, neck, décolleté, whatever you're doing. And again, the beautiful thing about that is that you're really then having an opportunity to upsell different treatment areas, okay? But in our instance, really, these treatments can have a high variable price depending on really the growth factors that we're using. With amnion, in an ideal situation, we would do 3 treatments, one of which would get the amnion. You could use other products, PRP or something else in the others. But essentially with the amnion, you would be, a treatment like this would probably run 3 for anywhere from $3,000 to $4,000. It's not unreasonable, again, depending on the grade of the growth factors that you're getting. So again, amnion is the high end. It is the golden, tree of life product that we have, and so that's what it is. So as you can see, we've done about 4 passes now on his scalp. How did it feel, my friend? Give us some feedback.
Not painful at all.
Not painful at all. So, he's really enjoying the treatment here today. Again, this needle, if I wanted to, we could just continue to treat his face. We could do his eyes, but the focus is really the scalp today. So again, this is micromotor driven. The machine is accurate to 100 microns. Okay, so it's very, very accurate in terms of the depth, which is critical. These are guarded needles, so the last 400 microns are not guarded. That's where the energy is. The rest of the needle is shielded. So the amount of energy that we're putting in is really minimal. It's just to get a small coagulative effect in the channel. Beautiful. Okay. So now we're done with that. Okay, so here we have the amnion. And what we're going to do is we're going to just put a little bit on the scalp and we're going to massage it in. I'm going to just have him hold his head up just a little bit so it doesn't flow out. So if you want to just give me the controller real quickly. I'm going to sit him up a little bit. And do we have a bouffant ready? Go and rest your head back there.
Here's a towel.
Okay, we'll put the towel down here.
Yeah.
And we'll grab a bouffant.
We're good, Stacy.
So lift up your head, my friend. Okay. Right, go and put it down. Okay. So now what I'm going to do is we have the amnion. We're going to take this amnion and we're going to put so I'm going to just put it right here, topically into those channels. And we're going to massage it all the way in here. So what we've done is we've made 22 to 2500 micron channels. This is one of the highest grade amniotic products that you can get. And we're basically just massaging it right into the scalp here. Now he does have quite a bit of hair still, so you want to get it as close to the scalp as possible and really just push it in. With the PRFM, sometimes people will inject. There's some good literature on PRP and PRFM for the injection.
Dr. T, why would one person choose amnion over PRP or vice versa?
It is, so you really have to get into the properties of growth factors. Amnion has the most immune privileged, really highest concentration, specifically lots of anti-inflammatory growth factors. The real big growth factor that we love is GDF11 and others that are exclusive to amnion. So for hair regeneration, amnion in the higher circles is very, very popular. And so we're very, very preferential to clients who are willing to. Again, it is a much, much more expensive product, but for the clients that really want the best, really the best, you can't beat amnion. Amnion is the best. But beyond that, you can use other products, you can mix and match. But we really now get it in here. We really massage it in, and we let the amnion sort of dry onto the scalp. And you can really see it just goes right in. We've made these deep channels. It hardly sits on there. It goes right in. And we're just massaging it in. Okay. Bring your head up just a little bit. We're going to come right to the back here. Okay, and that's pretty good. We're well covered. We're going to do a little bit more for him off camera. Okay, I'm going to stop right here and talk a little bit about the hair recovery so we don't spend too much time just massaging amnion in. So I'm going to let this dry. We're going to come back, massage a little bit more. Remember, with the Vivace, the channels are open about 4 to 6 hours. Okay. So there it is. All right. So just for those of you who are joining us recently, we're doing a Vivace treatment. Vivace is really 3rd generation microneedling with radio frequency. This machine uses micromotors. We love it here at Arizona Facial Plastics because it gives us a really, really nice capacity to be very specific in the treatment of our patients. Okay, so we love our Vivace. The needles were driven between 22-2500 microns with the micromotor. Has the red LED. Okay, so you can see that. So we did approximately 4 passes, level 2, 100 milliseconds, and we basically did 1.6, 2.2, and 2.5. So 1600, 2200, and 2500 micron treatment into the scalp. And then we just finished the treatment and we did the amniotic treatment. These are single-use needles. They come packaged sterilely. So once we're done, we could have continued to treat his face and whatever, but we're not doing that today. We're going to basically dispose of this in a sharps container here in a little bit. So I'm just going to rest this aside back here. Okay. Let's talk a little bit about aftercare. Okay. It is imperative that you have a good hair protocol for what happens to these patients afterwards, okay? And there are different products that are on the market. I'm going to talk to you about what we really have found works well at Arizona Facial Plastics. These are products that we sell here, and we're very proud of our work with Omni. So Omni has a hair restorative complex, and this product is essentially if I can open this package here, I'll show you how it works. It's taped in here. The package is so well. There we go. Do you have like a knife or something?
Just pull it from the top.
Yeah, I'm just going to peel this off here so people can see the box opening correctly. I have no nails, so I'm going to have to get somebody with nails here to open this up. Can you do that, Stacey? So this is the serum, and this is a very popular serum that people will microneedle into the scalp. So let's say today we did not want to do amnion, we didn't want to do PRP, but we wanted to use some other topical product. This is a very, very good product. It's a special fraction of cultured fibroblast media. It also is 99.9% pure, so it's one of the purest products. What makes Omni unique is it's one of the first companies to not grow the cells in bovine serum. So companies that make cultured media products often use bovine serum. Bovine serum has a lot of issues with the interaction with cells. Omni uses another media. So these are very, very well-grown cells. The cultured media result of Omni is considered by me and others who've used it as some of the purest and best products in the industry. So for example, with this kit, you could do 3 or even 6 Vivace treatments with it. And you could use this right on the scalp right after the treatment, okay? We're not going to be doing that today because our focus is amnion, but one alternative at a different price point would be this. So for example, in this situation, we're only going to do amnion once because of the price point limitation. We would bring him back on the 2nd and 3rd treatment, for example, and do PRP or Omni instead. Now the more exciting product is the daily hair restorative product. And this one's interesting because it has a molecule called MA007, which really is a product, it's a delivery product. It helps create better absorption of the growth factors into the scalp. So this is the product that we usually will send people home with after these treatments. So this is all included in the price of a treatment. And this will last at least through the next treatment. So usually you want to do this about twice a day. So we're going to be leaving him with this this afternoon. But right after the amniotic treatment, we don't want to put anything on the scalp. Usually we'll put a bouffant on the patient, and then we let it go with that. At ABM, Aesthetics Biomedical has a spray called the Soothe Spray. It's a fantastic hairspray to help kind of cover the growth factors as they've been put in. We don't, I don't know if we have any Soothe here today. Out there we do in that box if you want to bring that kit. So I'll show you those products. The spray is a fantastic product for whether you're doing the Vivace on the face or the scalp. It really works very nicely. But that's really been another product that we love. And I'm going to actually showcase it here in a minute. So we like the Omni. We love our the recovery products, especially the Soothe Spray. The balm and the mask are more relevant for when you're doing facial treatments, etc. On the hair, you don't really want to put the balm. No relevance for the mask, but the spray is fantastic. So if we're doing PRP and whatnot, we'll usually do the spray. So today, after I'm done off camera with the amniotic injection, we are going to be doing the spray. So this is the Aesthetics Biomedical Recovery Kit, okay? So it has what's called the Soothe Recovery Spray. It also has a cleanser and a balm and a mask if we were doing further treatment. But this spray is really awesome. And what we do is after we do a treatment, we will spray the scalp with this. Now again, we're going to do a little bit more here off camera for him, but this is the spray that I'm going to be using when this is all said and done today. Okay? And we love to soothe with, if you're using the hair restorative products, complex products, PRP, anything of that nature, the soothe is really fantastic. I'll set it aside here. So just to review our protocol here today, we used Pinnacle numbing cream with VersaPro. We numbed the scalp for about 40 to 45 minutes prior to us coming on camera here. We did the Vivace microchannel creation, okay, with guarded needles with 2 megahertz. We did approximately 4 passes on the scalp. We then used amnion, and we topicalized the amnion onto the skin and post Vivace. And then when we finish up today, we will use the Soothe spray on the scalp, which you see right here. And then finally, the patient will be going home with a hair restorative product that will help with the treatment. Our patient described very little pain. Do you want to give us a few words on camera here? How did it feel? Was it uncomfortable?
At first it felt a little sharp, but you just get used to it, and
Right.
you don't even notice it at all after a while.
Yeah. And we numbed him right up to this point here, so maybe we could have put some more numbing cream on the low side. Probably we started in the area that was less numb, but he tolerated it well. He had less than 3 out of 10 pain, which is very, very reasonable for this type of system. You can see the scalp is not bleeding. We put the amnion in. We're just letting the amnion set here a little bit already. And I think we're in good shape. And then off camera, we're going to put a little bit more amnion on, and then we will finish up. Well, it is now 12 o'clock, so this is the end of our Facebook Live. Thank you so much for joining us. Feel free to, our practice is Arizona Facial Plastics. If you have questions, if there are any people interested in this treatment, definitely give us a call. On the aesthetics biomedical side, if there are physicians or interested people in my treatments, I'd love to speak with you and give you some more information. But otherwise, it's been a pleasure being with you guys here today, and I hope that we can come back, I think as soon as tomorrow. We might have another Facebook Live, so this should be awesome. Thank you so much, everyone. Take care. Bye-bye.